Hi, everybody. Welcome to the 2023-2024 LHS Collaboratory Seminar Series. My name is Ed Hurwitz. I'm one of the directors of the LHS Collaboratory. My role is the Learning Health System Clinical Championship at the University of Michigan. Today, we're going to be talking about ethical AI in healthcare. So we have an interactive session today. The chat pod will be open. There'll be questions posed by the speaker, and we'd like everybody to respond to those questions. You can network and interact with fellow attendees as well. The Q&A pod will be open. Please ask your questions. Put them in the Q&A pod, and then we will read them out during the Q&A session. Do you have something more to share than just what you can type in? Request that we unmute you. You can put that in the Q&A and request for an unmuting so that you can elaborate. So today, we're pleased to have Jodyn Platt, who is an associate professor in learning health sciences. We'll be talking about ethical AI in healthcare. She'll be talking about TIERRA, Trust, Innovation, and Ethics Research for Responsible AI. So let me tell you a little about Jodyn. Jodyn is a PhD and MPH, as I mentioned, associate professor in learning health sciences at the University of Michigan. She was trained in medical sociology and health policy. Her research focuses on issues at the intersection of informatics and ethics. She is interested in understanding what makes data-driven health trusted and the pathways for earning, achieving, and sustaining trust across stakeholders. Dr. Platt is the Academy of Health and ABIM Foundation Senior Scholar in Residence for 2022 through 2024. She's advising on issues of measuring and building trust. Her recent work, largely funded by the NIH, examines public, patient, and other stakeholder perspectives on policy for data and information in precision oncology and the use of AI and machine learning in clinical decision support. The goal of this work is to identify factors that influence trust in complex information systems and to develop evidence-based and actionable recommendations that can inform issues of institutional, state, and federal health policy. She's a member of the GO Team and Policy Task Force, Learning Health System Third Century Initiative. She's the former assistant director of the Life Science and Society Program. She's a former member of the Michigan Department and Community Health Community Engagement Working Group for the Michigan BioTrust for Health, and she's a founder and former chair of the APHA Genetics Forum. Dr. Platt, we're so pleased to have you speak today, and I will turn the podium over to you, if I can.
Thank you. And I am tremendously excited to be here. I am excited to be here. Thank you all for being here. I need to shoot. Everybody can see my screen. Is that true?
No, Jodyn.
Okay. Thank you. Now you can see my screen, right?
We can.
Yes, you're good.
Yay. All right. So yes, I'm very excited to be here today. Thank you for having me. Thank you all for being here. What I'm going to do today in the next hour and a half or so is to talk a little bit about how ethics of AI is sort of intimately integrated and connected to policy and practice. For me, they're really sort of inextricable. So I want to sort of make some of those connections. I'd like to provide very sort of basic framework for how we think through ethical considerations for AI in healthcare, how options can be generated for organizational practice, how we think about measurable outcomes, the role of evidence, and how that reflects the values that we have as researchers or institutions or even as people. And then the most exciting thing for me maybe today is to introduce to you a new program that we have that's a joint program between IHPI and the Department of Learning Health Sciences called TIERRA, which stands for Trust, Innovation, and Ethics Research for Responsible AI, and to really begin today to launch a discussion of its goals with all of you here that are present today. So I want to start just by sort of putting out there that for me, ethics, equity, and responsibility can be seen as enablers and not as impediments. So for some people, ethics sort of stops and ends with compliance, and obviously compliance is incredibly important. But it, for me, is very much the first step or the baseline for what we need for an ethical system to exist. So there's compliance, and then there's sort of everything else that we should be doing. Ideally, ethics and equity are providing the safety features that allow us to get to new places we've never been before. Because we're in Michigan, the car metaphor is apt here. We have seatbelts in cars so that we can make cars that go faster and drive further. So for me, ethics is that enabler. And I hope by the end of today, you can sort of see what we mean by that. So I promised this, and Ed promised that this would be an interactive session. It is. And we're going to start right now. So we're limited in some ways by being on Zoom. In other ways, it's an asset. We can have a larger conversation with more people. So I'd like you to put into your chat to begin to think about what your hopes are for AI in healthcare. And I'm going to stop. I'll go to the next slide as soon as I start seeing the chat bubbles start to increase. If you have questions for me or for everybody else that's organizing, put those in the Q&A. But start to use the chat to tell us, sort of talk about what your hopes are for AI in healthcare. All right, great. So obviously ethics and governance right now are very sort of hot topics in ways that they haven't always been, and the context of AI. For me, I think one of the reasons that we are talking so much about it right now is that our health systems in particular are in sort of a new era of how we organize ourselves and how we use policy. So there was at one point, and this is something that came up a lot in context anyway. So the old practice paradigm is that we would have an intended purpose for research, for collecting data, and for developing technologies. Those purposes could be research, they could be quality improvement, clinical care, public health, et cetera. But we would need to define those before we were essentially allowed to go and collect data. So if we're collecting data for research, we then know what policies need to inform what it is that we're doing. Policy, so if it's research, we would often need informed consent. If we didn't need informed consent, there were very clear reasons for why. Same for clinical care. We have rules that govern how we collect data for clinical care. And from those sort of rich data sets, we could then develop new technologies through research and development. Where we are right now, and it is fairly new in the last 10, 20 years, we now have the capability of just collecting data and increasingly we're also able to develop new technologies because it's fun. And it is fun and it is exciting, but it means that we're sometimes sort of backing ourselves into the intended purposes, and we're at a little bit of a loss to know which policies we should be working through and which ethical frameworks we need to use to guide our work. So ChatGPT is a great example of this, where we have a ton of data, we developed this new technology, it can do very cool things, and now we're trying to figure out what we can do with it to improve clinical care. How can we use it in research ethically? What does it mean for administration and how we run and operationalize health systems? So we're doing this, but we also are at the same time now also having questions about, well, wait a minute, what about privacy questions? What about quality? What about patient, consent with the use of these tools? So, clearly it's confusing, but maybe confusion is okay and it doesn't matter. And I would just sort of like to posit that it does matter, in part because if we don't have policies and accountability, we can't have a trustworthy system. And I just think this is a nice quote from Thomas Paine, A Body of Men. He's talking about the aristocracy, but it applies to an aristocracy that we currently live in. A body of men holding themselves accountable to nobody ought not to be trusted by anybody. Another sort of foundation, I think, for where ethics and policy begin to come together is through this sort of paraphrase from one of my mentors, who's for a long time at the School of Public Health, Toby Citron, who used to very eloquently summarize the future public health report that was written many years ago. But he talked about policy as being this sort of linkage of knowledge, values, and a course of action. So policy is that thing that you decide to do or not do that combines various forms of expertise with community values. So any policy that we have is going to reflect the things that we most value as a group. Our policy people out there will know that there's always one policy option to consider, and that's to do nothing. For the most part, I think many of us have decided that in the context of AI, that's probably not tenable, in part because our digital world, the extent AI is sort of that's it. Our digital world will mirror the challenges and biases and inequity in our three-dimensional world. So that's one reason among many why doing nothing at this point is sort of an untenable solution. Which leads us to our second survey or chat question for you. Again, so this time I'd like you thought about your hopes, think about what your concerns are about AI in healthcare. And again, if you have questions, those go in a different section, but let's start thinking about, we've thought about our hopes, what are our concerns? Great. Great. All right. So we thought a little bit about hopes. We thought about concerns. We're starting to see how, ethics and what we choose to do or not do is ultimately sort of a reflection of values. How can we begin to sort of integrate that into how we operate, how we exist as systems, as organizations, as parts of communities? And this is a framework from UC Berkeley. I like it because it's focused on solutions and options for sort of addressing ethical issues, even as you're raising them. So I'll go through this fairly quickly. There are others out there, but I like this one, and I think it helps frame how we think about ethical decision making. So the first step in this sort of process is to begin to ask questions to identify what the issues are. And I'm going to talk in a minute about what some of the issues are for AI in healthcare, but want to sort of, again, posit that we have out there the issue of unclear intended uses sometimes. So in some ways, the issues will be shaped by what our intended uses are. The more use cases we have for AI, the sort of different valences we'll be able to achieve around what the ethical issues are. Issues that are also oftentimes tied to outcomes and sort of how we think about outcomes. I'm going to talk through sort of different ways of framing outcomes that, again, demonstrate how what we measure is a reflection of what we care about. And then to also, another sort of a theme I'd like to drive home with this framework is that there is a role of research and systematic review at each of these processes to make sure that we're getting to the answers that we feel good about over time. So there are a number of ethical issues and challenges for institutions, for peoples, for society. One of them, one of the biggest challenges or opportunities, depending on how you want to think about it, but any organization or group of people is working within the context of an open ecosystem. So any ethical issues identified in one context is likely to have spillover effects into other areas. And I'm not going to go through all of these. The slides will be available if you want to sort of think through how these might be examples of ethical issues, but just to highlight a few at each of the levels. So we think a lot about the issues of bias and data going into that are sort of reflected in AI and other sort of similar data technologies. So who's represented, who has access to the new technologies, who is actually accountable in these systems is one set of ethical issues. In the context of some of the sort of chat GPT kinds of AI applications, there are questions about how that will impact relationships for better or for worse, say between a patient and a doctor. If communications are coming from an AI tool, is that a good thing? Is that helpful because it gives us more people time? Or is it negative because suddenly there's a new technology that's placed in between a patient and a doctor, and it sort of it defrays some of the expectations we have for who we're communicating with at any given time. For organizations, there are big issues of accountability. There are issues of go and no-go policies that are often sort of not yet clearly articulated. At what point do we turn an AI tool off because it's not working, and how do we know it's not working? If we're using the next issue around contingency and dependencies, if we have an AI tool sort of on the routine now, sort of that's become a part of routine practice, and it stops working, or we need to turn it off, or there's power outage, how are we still able to deliver the kind of quality of care that we want to without the AI tool if it's no longer working for us? And then there are other issues around transparency and the pace of innovation that are clearly sort of at the forefront today. At the societal level, at the global level, clearly there are issues around sort of inequity, and that goes back all the way back to the very beginning around issues of bias and representation, but that ends up getting operationalized as sort of perpetuating inequity and justice. There are also sort of questions these days about the sort of straight environmental impact of supercomputing. So clearly there are issues, and we'll get to solutions in a bit, but I also wanted to talk a little bit about sort of how we think about the intended outcome. If we're using an AI tool, we want to know if it works. We want to know if it's fair. So for data scientists, fairness is around findability, accessibility, interoperability, and reusability. If we're sort of trying to understand that in the context of a health system and healthcare and health outcomes, fairness can have other types of meanings as well. So this will be familiar to our ethics people in the field, but we can think about, if we're using an AI tool, are we using it equally, or does everybody get the same treatment? Is it something that's adaptable to patient needs, or are we sort of working with the AI tool and the removal of systemic and structural barriers at the same time to achieve something that looks a little bit more like justice? So again, in the context of AI, you can look at outcomes. We can say, okay, is the AI tool used for all patients? And if that's what we decide, that's our metrics of success, then that's one way of achieving it. If we're interested in equity, we may be interested in more in sort of the outcomes of, is the AI tool improving health? And is it doing so in a way that's achieving health for all? And if we care about justice, we may care about both of those things simultaneously, but also about the patient experience. All right. So we've identified issues. We've thought a little bit about what we care about in the end, like what's our outcome of interest. The next processes for sort of ethical decision-making often circle around considering stakeholder perspectives, testing solutions, and then evaluating and iterating for ethically justifiable solutions. And again, to say here, I'm going to go through the rest of this framework fairly quickly, but to say that for each of these steps, there's a role for evidence and a role for different types of expertise, and making sure that we're addressing and incorporating the types of expertise that need to inform how we think about issues. All right. So I'm not going to go into our research that we've been doing sort of in our lab, just to note that there is research that can be done, and that research is available to be done sort of qualitatively, quantitatively, and engaging sort of multiple disciplines and stakeholder expertise. And to sort of, again, to begin to preview how we can then communicate findings to all stakeholders. So this is an example of what we've been working on in our group to be able to synthesize and return results to communities where we've gone into, we've collaborated with people living in Michigan, so not necessarily active patients, but community members, to ask them about what they would like to do to address the issue of transparency. So so there are many issues that we could be addressing. One of the ones that we've been tackling recently is that of transparency. And so in the end of February, we started what is going to be a series of public deliberations to find out what people want to know about the use of AI in their healthcare. And this label is an example of just that kind of intervention or sort of result that hopefully then somebody else can pick up and begin to implement in other places. All right. So this is one of our last chat discussion questions here around what would you, so the next question is, and the chat's pretty full right now, but we'll have a few minutes to sort of begin to think about the prioritization, sort of begin to think about what's going on in the chat. So the next question is, how would you prioritize in the next 3 years, or what would you prioritize for health AI to be ethical and trustworthy? That may be a set of research questions. It could be policies or policy gaps. It could be specific use cases that you're familiar with. I just want to make sure that is the chat working properly? Lisa?
Yes, it's working just fine.
Okay,
Yeah,
It is
folks.
actively working.
Yes, and folks
terrific.
have also been requesting access to the chat transcript. So for everyone, we'll work on that. We'll clean up the chat and put the responses with the questions and have that available.
Yeah. Terrific. All right. So, one of the conclusions here is sort of where, we think about, we have our ethics and values that we are most interested in. We have new informatics tools and AI implementation and policy and sort of, ways of generating policy to make sure that what's being done reflects the ethics and values that we want to be reflected. One of the novelties and one of the, I think, major challenges that we currently face with AI and making sure that it's ethical is that really to have ethical AI is a longitudinal commitment to evaluation, because it's not like it's a tool that will only have sort of a single cause and effect. It's ideally sort of learning over time. It itself is changing over time. And so we're finding ourselves in a place where we need to set up governance and new systems to be able to ensure that our outcomes are matching our intentions, which actually I think gives us the opportunity for a better health system. It's one of these places where, dare I say it, learning health system is paramount because it does require that collection of data, analysis of data, and then acting on what we learn along the way. We need evidence to drive decision-making and evaluation. We can certainly sit around all day and think about what the options could be, maybe should be, that can even come from expertise. But much of our research has often indicated and pointed to the need for going beyond our comfort zone sometimes and talking to stakeholders that we may not be routinely part of our daily work, but are nonetheless impacted by what we're doing in healthcare. And then finally, to note that this process of evaluation and thoughtfulness around the ethics and use of AI means that we're in a position to make unanticipated consequences anticipated. So there may be unintended consequences, but if we can anticipate them, we can certainly mitigate the harms that may come from them. All right. So with that, this is sort of what motivated us, I think, in large part to develop this new program on trust, innovation, and ethics research for responsible AI. We see trust as sort of a cornerstone of what health is and where and of the thing, and it's sort of at risk in the context of AI innovation, because we need to sort of find new ways of addressing it. Ethics and then research is sort of being a foundational for what it is that we're doing to hopefully contribute to the future of responsible AI. Tierra is a Spanish word meaning earth or ground. Earth can either be the planet or earth as in the earth the ground that that stand on. It also refers to, can mean land, soil, and for some people, and in some contexts, refers to homeland. So hopefully, finding ways to ground our conversations and decision-making with respect to AI. I said at the beginning that TIERRA is a joint program between the Department of Learning Health Sciences and the Institute for Healthcare Policy and Innovation. Our mission is to empower evidence-based decision-making around policies and practices that foster trust, innovation, ethical, and responsible use of health AI. Our vision is to gather diverse expertise from academia, industry, government, and communities to create collaborations, research, roadmaps, and resources that inform best practices for policy, best practices and policy for health AI that serve both people and institutions. Our core values are working in the interest of the public good, equity and justice in the ways that we defined them earlier, sustainability, communication, and hopefully improving health along the way. We're part of a sort of hopefully beginning to become a little less fuzzy in the world, but part of a health ecosystem, a health AI ecosystem that already exists, where there are both sort of tremendous resources here at the University of Michigan, outreach and collaboration with people, populations, and professionals, relationships with merging coalitions and partnerships that are largely sort of spearheaded at the moment by academic medical centers in partnership with industry and to a certain extent community organizations. And then there's a lot of policy that's being currently formulated and beginning to be implemented, whether that's at the FDA. The executive order from President Biden at the end of last year begins to lay out a roadmap for where AI might be going in the next several years and how we can use policy to shape that. Industry is fast at work here. And clearly there are sort of institutions and hospitals, care settings that are beginning to understand how and why or that are beginning to implement AI and needing guidance on how to best do that. We are a growing group. I've highlighted, I have a thank you slide at the end that again is I probably missed people, but it's a very big, I'm very excited about all of the energy that's being put out here. And we're beginning to have not only sort of collaborators here within the University of Michigan, but have ambassadors both across campus. So in the School of Public Health and School of Information, as well as across the and other universities. My colleague Paige Nong and Karen Deep Singh now at UCSD and University of Minnesota, and our community partners who have been with us for the last many years and definitely helping us and make sure that what we're working on is relevant to the public and patients and people in general. What we'll do is, again, we'll have a little bit more of a conversation about this in a bit, but our goal is to be able to inform policy and practice through creation of evidence-based guidelines, developing evaluation metrics and tools, cultivating collaborations, community and partnerships, and really beginning to elevate the research practice and experience at U of M beyond. We're going to be able to do a very small slice of what needs to be done to ensure trustworthy AI is meaningful. And luckily, we're part of a big community that's doing a lot of fantastic work. So the next step is we're going to turn to the Q&A in just a minute, but I'd like everybody to take a couple of minutes now to just sort of scroll through the chat, and maybe you've been doing this already, but to begin to upvote, downvote. There are also ways I think you can actually emote if you want to with your little chat options, but in any case, I just sort of get a sense of, we can all take a minute to read through the chat and see what's there, because clearly there's a lot of activity. So let's do that. I'm just going to see real quick. Okay. Also gives me a minute to look at the chat. All right, the other thing to begin to work on before we turn to the QA, and this will end up at the basic, we'll put this in the chat. And we're going to look at the results in real time. So this is not an end. But if you want to take a minute, either if you want to use the QR code, it's here. Rima, will you put the chat, the bit.ly in the chat? It's a very quick survey. It's really, you know, a couple minutes. No, it's quick. It's fast. It's anonymous. It's also anonymous. All right.
So Jody, while people are taking the survey, does that bring us to the Q&A?
It does. And I'm going
All
to
right.
stop sharing.
So one of the first questions here is, can we achieve a national societal imperative for conducting research employing AI? And what does that look like?
So I'm actually going to ask Ray to clarify the question a little bit, unless you think.
Ray, you want to open your mic and tell us what you mean? All right, let's go on to the next one. Or maybe
Okay, I'll also think about it and sort of try to come up with an answer because it's
okay.
Oh, there he is.
Oh, okay. Go ahead, Ray.
Oh, can you hear me now?
Yep.
Yes.
Yeah, thanks, Jody. Well, I was just thinking, you know, probably down the road a ways, it'll be important for AI to be, you know, for access to AI to be pretty generic to answer, you know, really important societal questions. And I'm just kind of wondering if there are any, you know, legislative address anything in the legislative realm is being addressed with respect to that sort of you know, broad use of AI. I mean, you know, it's like, just for lack of a better example, taxes. Some of us like to pay taxes, some of us don't. With respect to use of our information, health information, some of us are more wary than others. But and taxes, of course, we deal with legislatively. So I'm kind of wondering if there'd be any similar approach to making health data available for general use in AI.
So, I mean, I think that's basically what the major question is right now. There is a lot of sort of what is the option around opting in and opting out. I mean, I think we're beginning to get to a point where opting out is not terribly tenable because of the way in which, or at least from the data side, right? Because to be able to, you know, withdraw from one thing, it sort of becomes a whack-a-mole kind of situation. And I think where the policy is moving, or at least, and probably could be moving and probably should be moving, is more around sort of consequences and protections of harms or benefits that come from it. I certainly think at some point, you're absolutely right. AI will become part of the infrastructure, or we will hardly notice it's there anymore. So I think that's certainly part of the conversation and where things are headed right now. I know I was just, you know, in a meeting today with the NIH Office of Data Science, and the investment in AI it's a hockey stick, right? So it's not, and you know, their statement is it's not going to go down anytime soon. So we're getting there, whether we're ready or not.
So the next question is, are questions of fairness, equality, equity, justice premised on some level of scarcity? Does that drive some of the questions?
That's a great question. Before I answer, I just want to like maybe put the chat one more time. Put the survey there. We'll go over the results when we have a certain, like I don't know, we have 197 people. I think we need hopefully 100 people to answer the survey before we can look at the answers. So keep answering it. So certainly, I mean, it's much easier to be fair in the world when we have when there is no such thing as scarcity, right? Everybody can have everything all the time. I think that and I think probably some of our own ethical issues that we're facing in the context of, yeah, some of the things that we have, some of the issues that we're facing are anyway, they're related to the fact that we live in a healthcare system in the United States that is not available to everyone. And so there's inequity in the health system, and so there's going to be inequity in the AI that is sort of there. So that's how I think of those questions.
Next question is, are there concerns about the overarching term AI without really being clear on what it means or what it's doing for or with patients?
Well, I mean, so there's a yes, and when we've done some preliminary work to try to understand how to talk to people about the use of AI, there's yeah, I think what people seem to focus on more than anything else is the use and application rather than the specific technology or methodology. So the fact that people don't know what AI is, in fact, that we spoke to a very, range of people, including people that are sort of experts in AI, and it's a very difficult thing to define. We now sort of have a legal definition in it that is related to that's in the executive order. That's sort of, there's a legal articulation, but I think what people care about and what patients care about is the sort of the effect and the outcome. So I think by focusing on that, we can begin to focus a little less on the definitional aspects.
Is there any hope for accountability, transparency, and shared governance when profit plays such a large role in how any healthcare technology is disseminated and used? And I think I'd add, especially in our fractured health system.
So I do not want to be the one to say there's no hope, but it's clear. I mean, it's a huge challenge, and I suppose if there's any yeah, I don't know how, I don't know. I wish I could say that I don't know. I will say that we have, certainly done enough sort of public deliberations and conversations with people. That if there is one sort of ray of hope here, is that when we speak to people, they understand that there is a role of profit and there's a role of commercialization. I think that this is another place where figuring out how to foster the sort of public good piece of AI in addition to the profit piece. It worries me that at the moment, the big tech companies are defining what ethical AI is and what the rules and regulations should be around it. So it becomes, paramount for us to be able to inform public policy that hopefully puts some limits on that profit edge. But it's tremendously difficult, and with for all the reasons we just talked about.
Okay. Next question is, what efforts are underway to develop a regulatory structure modeled after the FDA, including the requirement that AI demonstrate efficacy and articulate risks? What about in situ testing of AI, including, impact of updates, that kind of thing?
Yeah. So there is at the moment so I would say at the moment there's certainly calls for independent sort of oversight and sort of a new organization essentially around the issues of AI within and outside of healthcare. That's been advocated for in a number of congressional hearings in the last year or so. Another sort of active player in the sort of the design and advocacy around independence evaluation centers is the Coalition for Health AI, which is a joint organization and founded by people at Vanderbilt, Duke, UCSF, Mayo Clinic, Stanford. There may be a couple of other academic health centers, Penn maybe, and a couple of industry partners to, and they've now sort of incorporated themselves as a nonprofit, and they've begun to spin off other organizations, one of which is an evaluation center that would get to the kind of questions that were just raised in that issue.
Okay.
Right.
There's a question about education relating to AI. Is there research into what kind of infrastructure would be required to teach the healthcare workforce about AI basics? The question stems from a concern that AI will move quickly, will be used by so many people who do not understand how it works, kind of like the EMR is today, how to change it, and what are the outputs and where there could be bias and inaccuracy.
Another great question. So we need training. Training is really important, and the question asker, I think is absolutely right that we're at a moment where we need, for example, leadership around this issue, and we don't quite have the workforce to be able to do it. So again, part of the executive order, for example, is to include AI leadership as a part of, a number of HHS and other federal agencies. And there's a very real question of whether we currently have the capacity to fill those roles. So that's another place where academic institutions sort of can't work fast enough to get the kind of the people that can take on those roles. And there are also issues, again, at the work, for physicians and other people who are going to be using AI that need to explain it to patients, et cetera. So it's a big issue, and one that we hopefully can begin to take on. Okay.
So your next two questions are both about bias, the bias about the information going into AI. There's a question about we have this feeling that computers are omniscient, and really they're just based on the information that goes in. What kind of cognitive biases would AI have? And shouldn't AI train on data that doesn't contain any preconceptions or social assumptions? How do we solve this problem?
So I would love for other people to answer this question as well. There's because I think that the issue of bias is going to be best solved, I don't know, it as a hybrid kind of solution. There have been examples of, say, AI tools like analyzing images that don't, for example, use race as variable, but are still biased in their outcomes and how they treat people because of the ways in which our society is biased. And so there's always, we're not gonna solve that problem. It will always be there, but it's the kind of thing where if we can, throughout the pipeline from development to implementation to evaluation, integrate ways of sort of checking and mitigating, then we can at least maybe reduce it. Did I answer that question in full? Ish. It's going to be a question of continuing. We still need to talk to people and make sure that people are part of the solution around bias, and there'll be a technical solution as well.
This question about licensure barriers for physicians, pharmacists, et cetera. Would you feel that the licensure barriers will be threatened by robust AI that can be shown to produce equivalent results for diagnosis and treatment recommendations?
I love this question, and I would add there's also physician, pharmacists. There's also scribes right now have sort of a threatened work position. There's I don't know. I think it's going to be a while before an AI tool can do something as well as a human reliably and 100%. I mentioned the scribe thing because a colleague of mine was talking about the implementation of, so scribes for people who aren't, are either people who listen to transcripts and make notes, or are in the room sometimes, or they there's an AI tool that can basically do that work for people. Except scribes are often also unionized workforce, so you can't just replace them without a number of legal issues, in addition to the quality questions around scribes, etc. But it's I
Okay.
like the question.
Should we be focusing on AI as one big abstract concept, or do we need to be looking more detailed into the various tools that algorithms, software to be considered individually and on its own merits? And while you're thinking about that, Jody, I just got a message that there's 78 responses to the survey.
Okay, so we need 12 more. So whoever you are, please go ahead and and we can put the link back in there, because I think the chat is crowded. All right. Sorry, can you ask one more? Or tell me who the
Sure.
answer?
Should we be thinking about AI as one big abstract concept, or should every method, tool, algorithm, piece of software be considered individually on its own merits?
So I think being able to consider each one on its sort of, both of those options are in some ways untenable, because of the ways in which if it's too broad and abstract, you don't really know what you're regulating. If it's too specific, there are just way too many tools and options out there. So I think in some ways, where another place where we have an opportunity is to begin to reclassify how we think about and what we want to regulate with respect to AI. In the EU, they've decided, okay, we want to think about, not about sort of what the AI tool does, it can do whatever it wants to do, but we want to focus on risk. So we want to take the very high risk, super dangerous kinds of applications and just say, no, we're not going to go there. So that might be sort of tools that are used for nefarious tasks, right? You're trying to, you're using the AI tool for hacking or for spreading, bad misinformation, whatever. There's sort of these no-go zones, for AI, ban those. Then there's low risk sort of AI tools that don't seem to do much harm, and so you sort of let those go. And then they're saying, okay, there are these middle categories where we want to be able to ensure that there's a certain level of transparency about their use, robust monitoring about whether or not they're working. So an AI tool, for example, that's part of a pacemaker might be in that middle category. It can clearly do great things, but if it's not working, that's a big problem. And so you want to have a high standard of quality for that kind of AI tool. So they're reframing that question to sort of be around risk. I don't think we've quite gotten there, but some at the level of institutions, some institutions, that's the way they're facing this question.
Okay. Next question is about trust. With trust in institutions declining in so many ways in the US, in all the public institutions, science and medicine seem to enjoy a special status of legitimacy. Do you think the use of AI in healthcare could significantly change that? And there's a comment along that with about fabrication, hallucinations, could make the misinformation, disinformation, and certain beliefs even worse than at present. I think about the vaccines issues and things like that.
Yeah, no, this is a huge issue, and it's one for, healthcare, I think, to reckon with a little bit right now, because the AI is a public tool. It's a tool that we all use. It's one that we carry in our phones. We all have sort of an access point for understanding what AI does and whether it seems to be working. Even the fact that I can use ChatGPT on my computer gives me a basis to evaluate ChatGPT that's being used in a clinical setting. Whether that's true or not, I can still form an opinion around, whether that is appropriate use in healthcare. And then that's going to impact how I feel about my health system. So it is very much sort of a place where whether health can sort of maintain its exceptionalist status is a big question in an era of AI. So yeah, thanks for the question.
Yeah. Okay. How could AI be used? Oh, there's 90 surveys, Jodyn.
90?
Yeah.
Okay.
96 now.
90 area.
How many?
98.
90,
98.
Yes, 98.
98. Oh, okay.
Okay, so we need two more. We'll do two more. We need two more surveys. We'll do two more questions, and then let's turn over to that.
Okay.
That sound.
How could AI be used to help employees who raise ethical issues in the workplace, such as substandard care, short staffing, sexual abuse, retaliation?
Oh, that's an interesting question. And one that I haven't thought about. I don't know.
I would say that AI is going to be good at generating evidence. It's going to be recording things. It's going to be knowing many things that happen. So for some of these things like substandard care, I could really see AI helping us to look for those kind of things. Not sure about some of the others.
Sure, yeah, and actually there was a paper that was just published that sort of notes that one of a sort of a big opportunity for AI is in, you know, the issue that you just brought up, that sort of there's people are not very good at vigilance. I think that was sort of the direct quote. I think it was actually a little stronger than that. It was like people are terrible at being vigilant. And so to the extent AI can help us with that part of what it is that we need to do, that there's certainly a role there. Yeah, thank you. That was a stumper.
Okay. Last question then. I'm wondering how the integration of AI in healthcare presents opportunities and challenges regarding the autonomy of both patients and healthcare professionals. In other words, what are the potential benefits and risks associated with AI-driven decision-making and its implications for patient empowerment, informed consent, and professional autonomy within the healthcare system? So thinking about autonomy of the patient, the healthcare worker, thinking about shared decision-making, how that will be affected. What will be AI's role in that? How will it affect that kind of thing?
Yeah, that's a fabulous question. And again, it's sort of it's very classic sort of ethics question for healthcare that so some of the pieces of, say, like the AI Bill of Rights, which was sort of the precursor to the executive order that was issued last year, the AI Bill of Rights lays out 5 principles that we should be thinking about when we're implementing AI systems. One of them is this issue of being able to opt out, being informed and being able to opt out of systems that use AI. It's really hard to know at the moment whether and how, to what extent that's realistic in the context of healthcare. But it's certainly sort of a value, if you will, that's been presented as desirable. I think at the moment, our best sort of first step in that area is transparency. If people can't, you know, have opinions about things they don't know anything about. So I think transparency is the first step to that question around AI. And I mean, that's for both patients and providers. And somebody talked about sort of the quality issue having an impact on the way people interact with the healthcare. And somebody else mentioned, I think, hallucinations are, you know, they're gonna have a big impact on how we feel about AI being a part of our care.
All right. Well, we're over 100 surveys. I just wanted to close this up. I just want to share a comment that someone wants to say that you were handling some very difficult questions with insight and appropriate humility, and I have to agree.
Thank you so much. All right. I love the questions. All right. Now I asked you questions. I want to see the answer. So Rima, who works in our team, is going to show us what you all had to say. All right. Yeah. Can you make it a little bit bigger?
Yes.
Great. All right, so mostly hopeful, mostly concerned. Let's see, so we've got 50, a little over half people say somewhat hopeful. So yeah, so there's a lot of hope in the room, which I'm enthusiastic about. I would be, if you have a minute to sort of maybe write in the chat about why, either regardless of, either way you sort of answered that, I'm just sort of curious, but yeah, it's great. So there is a lot of hope, I think, for AI in healthcare. Next. All right. What are the most impactful issues? And we asked you to pick 2 of these. So quality stands out as a tall one, and appropriate levels of automation. So those seem like, again, sort of great places to start with. And we'll share the results of this in addition to the chat and the slides. So we can look at these. So, but following quality and appropriate levels of automation, we're also looking at questions related to privacy and security, transparency, and then it looks maybe drop down a little bit to effectiveness, evidence of health improvement, and workforce development. All right. All right, then the next slide, next, on balance, you're concerned that health systems will move too fast or too slow in adopting AI tools. So, so we're optimistic for hopes, but we're worried that maybe things are going to move a little faster than they should. So that's, 50, 70%, and 30% ish. My math, doing math under all this pressure is a challenge, but I think I got the slices right. Okay, and then the last, this is again sort of a what do you find most exciting? So we've got personalized medicine, scheduling, image analysis, another personalized medicine, billing, predictive analytics, scheduling, a couple of, so we've got both clinical, looks like we've got clinical applications as well as administrative. Keep going. We can keep going, we sort of scroll, it's like biomedical research, predicting costs as a concern, administration. So it looks like people see a lot of opportunities for administration, image analysis, all of the above. Okay. All right. So, okay. And then AI tools that worry you the most. So yeah, we see both benefits and risks to all of our applications. Personalized medicine, medical records. All right, billing. So a number of issues that are on both sides of the equation. Okay. All right, reduces humanity and care. All right. Potential bias. Scheduling for urgent conditions. All right.
Yep, that's it.
Okay. LLMs, fully automated diagnostic errors. So making mistakes. So this is consistent with sort of our opinions around quality being a major issue, reliance on bad information, diagnostics, transient, etc. So, all right. I want to thank you all for doing that. So we still have some extra time. Again, if you have some other thoughts about, there's, yeah, any thoughts about the survey, and put those in the chat. It looks like we have some more time for, a few more questions. I literally have 2 slides I have to make sure we have time for. So should we go back to the Q&A?
Yeah, let's do that. Here's a question. How might AI reshape clinician-patient relationships and disrupt medical paternalism? How might increase love/care and true connections in the arena versus increasing the sense of efficiency and profit for healthcare systems?
So I think that for me has a lot to do with how we implement AI tools in the context of healthcare. So there was, you often hear that AI is going to be amazing because it's going to save time and allow us to have more face-to-face conversation with our patients, and to increase sort of our humanity in the clinical encounter. And I hope that that's true. Similar promises have been made around other information technologies, and going back to the sort of profit-driven kind of care that we're often a part of. What we tend to do with more time is to try to see more patients. So that would be one way to preserve that, is to take the time we might get and keep it for the sort of person-to-person relationship.
This is an interesting question, I don't know if it's a question for you or someone more clinical, but the question is there an opportunity to compare and reduce bias for coded data related to race, ethnicity, and language data by getting at the similar concepts such as using genetics versus widely varied gender or race data? The idea of using genetics for grouping people and understanding the clinical care would be very interesting.
So, I would love, again, for other people to answer this question in the chat as well. I don't, so for me, I don't think of gender or race as biological measures, but they're so trying to use genetics as a biological sort of measure for those concepts will always be problematic and won't work. But it's certainly an interesting idea. We've tried it before. It hasn't worked. And so again, I'm pessimistic that it will work in the future. But it makes a lot of assumptions about how we understand the genome and gene environment interactions and a lot of other things that are just, yeah, anyway, that's.
Right. Here's a question about malpractice claims, the legal environment. How is AI going to impact the legal environment, such as malpractice claims? For example, misdiagnoses or inappropriate treatments.
Yeah, that's a great.
Jody, I would add on, are we going to be able to sue AI? If it makes the mistake.
So hopefully it depends, right? I think that's exactly the essence of this question, right? Who do you sue? And at some point, the legal system will figure that out for us, whether we decide it upfront or not. And I think some of the issues around yeah, so some of these issues will get determined one way or another. And I think some of the active policy advocacy that's happening right now on the part of developers and tech companies is really around this question of who's going to get blamed for whether it works or not. Our colleague Nicholson Price and he was one of the authors. There was another person whose name is eluding me at the moment, but they've sort of put out a framework for how they think legal accountability is likely to play out in the court systems. And basically it depends on whether the AI works, whether it's got the right answer and the physician decides to sort of go against it, depends on standard of care. So those are sort of the three variables. It's sort of like who makes the decision, what's the standard of care, and what's the outcome. So we'll see.
Okay. Here's an interesting question, Jody. Would it be more useful to make AI a mediator between patient care and the provider as a quality control improvement mechanism, or to make the provider the mediator between patient care and AI, the way we understand it now?
That's a great question. So I talked a little bit about how, research can play a role in answering just these kinds of questions. I don't have the answer to that, but it's certainly one we can find out. And it's one that, patients are going to need to help us answer. People need to help us answer those questions. So it's not just a question of, so we need to look at sort of 3 levels of outcomes there, right? What do the patients think? What do the providers think? And what's sort of an objective measure of, is that a good thing or not?
Okay. Here's a thought about it's kind of a comment that turns into a question. So much of our language seems to treat AI as an entity, but ultimately it's the human side that faces ethical questions, because AI isn't sentient after all, is it?
No.
I don't know. Do you think there is any fertile ground in shifting language towards human ethical behavior in using AI?
So yeah, I think language is a huge problem and issue and question, and one that we should try to be a lot more careful about. AI is a technical solution. It's a technology. It's a thing. It's not sentient. It doesn't have a brain. It doesn't think. It doesn't feel. Those are things that we do as human beings. And so just being more careful about how we apply human attributes to this sort of funny thing that we're using is an important way of sort of, I think, maintaining that separation that will move forward.
Jodyn, here's a question that let me tell you what the questioner said, and then let's turn it around a little bit.
Okay.
Can AI help doctors determine the weaknesses in drug studies, which may be biased, such as significance of findings, structure of control, and intervention groups? And let's turn around and ask, can AI give us better randomized controlled trials? Can it, the implementation problem, right? The 17-year thing. Can AI help us to do better trials that are more acceptable and get things done faster?
Yeah, I mean, certainly in some cases that may be the case. I think that what certainly in the bias output, there's or the concern about bias is that, so if we rely too much on AI is, it's looking at historical trends and trying to predict the future. So if we want a future that's unbiased and better than the one we have now, we're going to have to make that happen. That's not something AI can adequately envision or create for us or predict even, right? Because if we've been biased in the past, we will be biased in the future. So that's one place I think where AI has a limitation. That said, AI can, for example, generate all kinds of solutions that we can't necessarily think of or process. And so there is a moment and a place for AI to help us process lots of information, to your point, to begin to understand things. There was a paper that was, I think it was in the American Journal of Primary Care. Somebody can maybe look it up, but there are ways in which AI can help us review things, maybe sort of summarize, but it won't be able to synthesize in the way that humans do. So even, there's anyway, there's there's a role for AI, there's a role for people. And we can't sort of give up our thinking abilities in the interest of AI.
How might we guard against conflicts of interest in AI inputs and outputs? And I'd add to that, how do we decide who gets to do the inputs?
Well, that's a policy question. I think in some ways we just decide, right? We just do it. We say, okay, this is, but hopefully we, can do that in a systematic and fair kind of way. I don't know how to guard it. I don't know. I mean, we've been trying to guard against conflict of interest in all kinds of areas, and I'm not sure we're very good at it. We have transparency requirements. We can have similar kinds of transparency requirements for AI. The Office of the National Coordinator recently has instituted a new rule around disclosure of data inputs for AI and predictive models in particular. So that's one way of sort of guarding against, so increasing transparency about what the data is going in can help us assess what we think of what's coming out of it.
Great. Okay, the last question here is just about, does anybody have papers on AI evaluations they find valuable and rigorous? I'd love to see some published papers that show the efficiencies and valuable implementations of AI tools in healthcare are often mentioned, but not necessarily cited. Anything you can quote, Jody?
I would actually love, that's, so, I don't know. I've had this conversation, so I wish I did know more, evaluations around it that are valuable and rigorous. I suppose, there's the seminal sort of paper on, that showed bias in evaluating healthcare needs and costs, the Zach Obermeyer paper. But again, that was sort of an ad hoc kind of evaluation. One of the main issues that we're facing is that there's a lack of rigorous evaluation. And there's certainly, there's a lot more noise at the moment than there is actual value. So that's something that we need more of in the future. Again, I would love for people to put in the chat if they're aware of those kinds of papers.
Okay, to build on the competitive theme and legal protectionism we've been talking about, to what degree do you feel we will have AI competition, where AI is doing tasks monitored by other AI in an escalation, wow, an escalation type dynamic? That sounds scary.
It does sound scary, and yet it's sort of, I think, one of the issues of where we're kind of headed. So, um, I don't know. I'm not sure that's a question. Is that a question? Do I feel we have?
Just kind of.
I mean, I think it points to, what it does do is it points to the sort of the urgency of the questions and sort of the need for the kinds of guidelines and governance and monitoring systems, both at home and across the country, probably globally, that really allow us to understand what this tool is doing within our health system and how it's interacting both with itself and the sort of people it's interacting with. So I think it just underscores like where this could be going and the need to start building that infrastructure of policy and ethics right now.
Okay. Any other questions? Anybody want to type any other questions into the Q&A or maybe ask them out loud? All right. Well, Jody, this has been fantastic. It's if you look through the chat, there's so many thank yous, and I'll just add mine on behalf of the Collaboratory. Really mind expanding and giving us a lot to think about today. So thank you very much.
Thank you. I'd like to have just one more comment, and that is to sort of, reemphasize that again, we're really excited to be getting TIERRA off the ground. In sort of a sort of recency bias kind of moment, I was watching the Men in a Boat. It's not what it's called, but the movie about the 1936 men's rowing team. That it's a very much an underdog story, which is an important story and a fun one to tell. But it's also a story of the negative split, which is basically the idea that you can win races by starting slowly, and we're learning how to work as a team. And so again, my vision for TIERRA is to be able to build those boats, build the teams, start slow, and move faster along the way. So thank you so much. I did have 2 more slides. One of them was the rowboat, and the other is to say thank you to all of the people that have brought us together today and sort of given us this opportunity to talk about something that's so important. So thank you all for coming.
Thank you, Jody.
Yeah.
Okay. Here we go. All right. Well, I want to thank everybody for attending. Up next, AI and Health Ethics and Policy Symposium. That's going to be a in-person event that goes from 9 to 2 o'clock on Monday, April 29th. It's co-sponsored by the LHS Collaboratory, the Michigan Institute for Data Science, MIDAS, eHealth and Artificial Intelligence, that's eHAL, and what we just heard about, Trust, Innovation, and Ethics Research for Responsible AI, TIERRA. So that'll be in the Great Lakes room in the Palmer Commons. And to learn more and register, go ahead and use that QR code. Why don't we just leave it up there for a second? Give people a chance to look at it. Okay, let's go to the next slide. All right, everybody please complete a post-event survey today. And if you'd like to receive CME credit for today, go ahead and look at this slide. Okay, I think, is that it? I think that's all we have. So again, thanks everybody for coming. Are we back in the presenters room?
Yeah,
Okay.
thank you.
Oh, thank you, everybody. Is Jody here?
I think she popped
Okay.
off.
Yeah, okay. Well, thanks, everybody. I thought that was a great, really great. So everything went really well, and boy, it was really well attended. We didn't get to